I am presenting on behalf of my PhD student, Jing. Quite sad she couldn't be here to present herself her work, but being Chinese, apparently she had a lot of problems to get a visa. So this is also why our paper did not make it to the final printed program. This is where we come from. We are from Toulouse, IRIT Laboratory, which is a large computer science laboratory, and we work in an engineering school devoted to Earth information systems. We are not specialists in serious games, but we are specialists in ICT for Earth and knowledge modeling for e-Earth systems. So I will be presenting the serious game that we are developing now. This is a serious game which is dedicated to training general practitioners, and there are many serious games who try to train some form of clinical skill for doctors, for example, training doctors for good prescriptions, or training doctors for medical acts such as surgery, but we focus on non-technical, non-medical skills, and especially we focus on communication skills and also on advocating and for the use of ICT for us, for general practitioners. So our target users are either general practitioners who are attending lifelong training sessions, or medical school students who are now attending a required internship in general medicine. This is something a bit new in France. Usually there was a big difference between general practitioners and specialist doctors who had to attend a 2 years internship in university hospitals. And since 1 year, there is a new diploma in France, which is specialist in general medicine, which is a bit of an oxymoron, but now general practitioners are also required to do an internship, which they do in the medical examination room of other general practitioners. The educational objective that we have dealt with in these games are first related to the use of ICT for health and e-health in general, and more specifically, we want to train the new doctors to the use of electronic health records. In France, there is a nationwide health record system that has been introduced a few years ago, and which is not much used by medical doctors. We are a bit reluctant to use it. So we want to maybe to improve this situation. We want to also to train doctors to e-prescription. That means the digital transmission of medical prescriptions from the doctor to the pharmacy, for instance. And we want also to train them to new telemedicine tools, for example, second advice or long distance medical consultations. And the other important point is to train the doctors in communication skills, the way the doctor communicates and maintains a relationship with the patient. This is almost non-taught in the medical schools. The belief is that this is something that you get with the experience of your work, and maybe we want to improve this situation. Something which is a bit special now is that with the introduction of this new internship in general medicine, in the medical examination room, you now have 3 persons. You have, of course, the general practitioner, you have the patient, and now you have also the intern who is under training. Just can show you a short video. Shows what it is, what it looks like. Maybe if you don't get the sound, it's not really important. So we have a medical doctor, an internship, and a patient. The patient is bearded man. And so Now the general practitioner has to deal with the presence of the intern and to guide the intern to examine and to discuss with the patient. So this is a kind of situation that we want to implement in our game and to support. So the game is in the form of a role-playing game, and the playing character is supposed to be a young doctor who just graduated and starts his career. And the main scenarios are based on medical interviews. The overall goal is to obviously to develop the avatar, and more specifically to discover some secrets about the patient that are being examined. And there are some secondary goals. First, to minimize the patient's stress, the patient is being a non-playing character. Of course, if the patient is less stressed, it will be easier to discover the secret of the patient, which might be a medical secret or a family secret, or something that can be revealed. And of course, the goal is also to increase the level of trust that the patient has towards the general practitioner, which of course makes it easier to discover the secret. The non-playing characters are the patients who come for a medical consultation with different difficulty levels regarding the patient. The intern trainee can be a non-playing character, also maybe a secretary that helps to arrange the schedules, and also other doctors that can provide, for example, second advice using telemedicine tools. The game is designed in several learning modules that allow for reaching several teaching objectives, and a training module that determines the overall flow of the game, and which opens new modules as soon as several objectives have been reached in the previous games. Give you a few examples of the modules that we are developing. The basic communication skills is the first module that will be presented to medical students. This is about raising the level of politeness, using clear expressions to other patients, suggesting or avoiding jargon, for example, when speaking to the patient, giving frequent summaries of the examination to the patient while he is under examination, and also encourage the patient to talk. Also, these modules are meant to train the students to use health records and to access the health history of the patient using the usual confidentiality rules that are relevant. A second module deals with more problematic patients for different reasons. For example, trains the doctors to communicate with patients with special needs or special medical conditions, such as patients that are hearing impaired or speech impaired, or who have some memory problems, such as Alzheimer patients. Also to deal with so-called difficult patients that might be angry, that might be reluctant to share information, that might be defensive or frightened. And also to deal with cultural, ethnic, and spiritual sensitivity situations. For example, in France, there have been several cases in hospitals of Muslim women refusing to be examined by male doctors. Of course, when going to the general practitioner, they can choose to go to a female general practitioner, but now with the new trainee that can be present in the examination room, the trainee can be a male. So we want to train the doctors to deal with this kind of situations. A third module is about special situation that can make the examination more challenging or more difficult. For example, the presence of multiple people in the examination room, the intern or companion of the patient, and how to communicate with not only the patient but with the family of the patient if it's present. how to break bad news, how to announce something unpleasant to the patient and his family, and also how to deal with environment issues such as privacy. For example, you don't say the same sentences if the secretary is present, for example, or if you are alone. So these are the basic learning modules that we have, and a chaining module is in charge of connecting all the learning modules to form a consistent storyline and to determine the condition under which new learning modules can be unlocked. And this can be done by the realization of some achievements for the playing characters. For example, as he develops the medical practice, he can gain points of charisma, of trust, and also gain enough money to bring computerized equipment to his examination room, and then start using ICT technologies during the examination, and also the occurrence of some in-game events, such as a call from a foreign colleague, for example, to give a second advice. So the examination is based on a conventional process of the medical consultation, which is usually divided in 4 phases. And the possible actions for the player have been identified by the expert in the healthcare domain, and also by experts in game design. According to the action that is chosen by the players, these actions have some influence on the patient's non-playing characters, and also in sequence triggers different actions from the patient. So we have constructed a database of dialogues that take part in all these phases of the medical consultation process, and some dialogues are linked, that meaning that they are depending on previous action of the user, and some being independent, that meaning that it can be used at any time during the game. The game features a reward system based on statistics. For example, the number of patients followed by the player, the number of meetings, the number of modules unlocked, the number of patient secrets that have been unveiled. And this allows for the development of the player avatar, gaining points in reputation, experience, etc., and to improving the office and the career with new medical equipment, etc. There is also some rewards in the form of medals that make concrete specific achievement, and that can also unlock new game models. So the architecture is, as usual, often divided in three parts. First, the scenarios that have been developed by the game designers represent the modeling of the patient, the generation of dialogues, and the algorithms for the non-playing characters. And the view part is designed by the graphic and animation designers, represent all the user interface that is used. And all the basic knowledge has been acquired by discussions with specialists in medicine, professors of medicine, and psychologists. So we are under development of this serious game. We have developed several learning modules. We are in the process of designing the user interface elements, for example, facial expression of the non-playing characters that represent the level of stress of the patient or his level of confidence towards his doctor. We are in the process also of continuously enriching the dialogue database that is used in the game. and we have performed some preliminary evaluation of the current implementation with students of the Toulouse School of Medicine. And this is here for my talk. So I am Rémi Bastide. This work has been conducted by Jing, the PhD student, under the direct supervision of my colleague Nicolas, and I am the professor who signs the paper and who gets to Rio. That's it. Thank you very much.
Thank you.